It's the system's a conveyor belt, and I'm not knocking that because it does keep everything moving forward,
Hmm.
especially in the emergency department. But like a grocer who's taking items off that conveyor belt, you come across a patient, and that's exactly what you have to do. You're moving along, but now something that requires specific individualized care comes along. And now you got to take that person off the conveyor belt. And I think a lot of new nurses don't realize that sometimes you're staring the system right in the face. I don't want to say push back on, but sometimes it could feel like that.
Yeah.
Sometimes you feel like you're putting on your boxing gloves to try to
Oh,
advocate for
for sure.
somebody.
Yeah.
And also, you don't win all the time.
No, you don't. Yeah.
And they never talk about that. They characterize it in school like you're going to advocate for a patient and the right thing will be done for that patient in terms of what you believe, because
Mm-hmm.
maybe a physician or someone else doesn't believe that's the right path. And that's their professional opinion. And you have your professional opinion, but you still have to deal with
Yeah.
that outcome
Yeah.
emotionally. And I had an elderly patient come in. I think she was like actually 102, and she's being taken care of by her family, but she actually had some gangrene on her limb. And when I went to touch her, it could have been from fright, but the way she moved, it was almost like she was just really terrified.
Yeah.
And is it from fright or is she being abused? She's here with gangrene. My mind is not really aimed toward as much toward fright. That was something I went right to my charge about. I tried to advocate for this patient, but ultimately I failed, and that hurt. That was my first real glimpse of trying to do the right thing, and it didn't work out.
Yep.
Another situation that was a surprise when I was a new emergency department nurse was we had a 16-year-old give birth in the shower. She hid her pregnancy for the first time. I lost a newborn in a code, but it activated a system in place where we were going to investigate whether or not this is a product of incest. And I didn't even think about something like that. Like I said, I was new.
Yeah.
And that's a form of advocacy we don't think about.
Definitely. There's
And
so many layers.
that situation, just because of the outcome of the newborn, was enough emotionally. And
Mm-hmm.
now you have to add on the possible incest on top of that.
Mm-hmm.
It's a lot. It's a lot that novice nurses might not be considering. So we had a woman come in claiming chest pain. She came in by ambulance. She had her daughter in tow. And even in the code room, we could tell this husband is a little trying to answer the questions for her, things like that. Long story short, the other nurse knew to separate them. Sure enough, as soon as the husband was out of the room, she apologized and said, "I'm sorry, I don't have chest pain, but he beats me, he beats my daughter,
Mm.
and I don't know what to do."
Yeah.
Or it could be the other night, there was a elderly patient. She had given herself 13 units of insulin when her blood sugar was 140 with her pump
Oh.
on accident. And it dropped from 140 and then to EMS 115. And as she got to me, it's 80. And I'm telling a resident, I'm just going to push the D50. It's like, let's give her some OJ. It's only at 80. I'm like,
Mm-hmm.
it's gonna drop. It's
Mm-hmm.
gonna be like 30, and before you know it,
Mm-hmm.
he caved. I might have been a little, his night shift. There's no one around. We're doing this. At the end of the
True.
day, it's my nurses know with
Yes.
advocacy. I'm sorry to cut you off. With
No.
advocacy, and shame on you, Stephanie. You're so nuanced in your answers. You're making my head go in three different directions. I have my notes here. No, but that's the other thing too with nursing. I had a nurse expert witness on the
Mm-hmm.
podcast, and you can be held responsible by doing something for a patient that the doctor ordered, that the doctor thought was safe, or if you
Mm-hmm.
don't advocate for your patient, going for, like that order, if that didn't work and she bottomed
Yes.
down and I got busy and something happened to that patient, legally, I'm probably going down with
It's
that
on
shit,
you.
not the
Yeah.
resident.
Exactly.
It's very reciprocal. I teach new nurses when it comes to like what are the majors and minors in charting or getting things done when you're
Yep.
busy. And I'm like, every major is connected to your license, because if they're here for hypotension and you're getting a report and it hasn't been done in 2 hours and no one knows that they're like 60 over
Mm-hmm.
20, you are going down.
Yes,
You
it's
took
on you.
report, you're going down.
Yeah.
And so advocacy is not just for the patient, it's for everybody.
Yeah, it's exactly. No, it's to keep you safe too, and everything that you worked so hard for to get to where you are. Bouncing off yours with like where you advocate for more than just the care, but now you're thinking beyond the care into the family life. Is there neglect? Is there abuse? Is there things like that? I've had kids come in who have very odd injuries, and you have to advocate for making sure that are they safe at home, or who is bringing them in, do they feel safe with them, and having that type of advocacy of where you're thinking more beyond just the current condition is something that I don't think a lot of people realize is a part of the nurse's scope, is to think of all aspects of the patient and not just in that current. So you want to make sure with these kids, are they safe at home? Do they feel safe at home? Is there anything going on? And having to advocate for that. And sometimes it's just my own worry for them. So I advocate in that way. And there really is nothing wrong. And then you think, dang, did I take that too far? Or was I overthinking something? But I feel like as a nurse, you almost have to, you're doing it for the benefit of your patient, and to not, at the end of it, whether the outcome is in your favor or not in your favor, your advocacy matters. And like sometimes I feel like new nurses are afraid to overstep, or they're afraid to feel dumb if they bring something up that's not actually the case going on, like some sort of abuse or something like that. Like that's the best example I could think of.
Oh, yeah.
Yeah, and they feel like dumb if they were to bring that up, when in reality, like I feel like that's a good nurse. That's the nurses that I would want taking care of me and my kids, future kids. I don't have kids right now, but future kids one day. And even there's a story in my book, one of my chapters, that I talk about a patient I had that had a very crazy transfusion reaction at home, but we didn't know it at the time. And she was declining in the ER. And I was the only one that was there to witness this, right? As nurses are the ones that are at the bedside the most. And to see that, to have that mental battle of how am I going to push for what I think is right for this patient? No one else is seeing what I see, and I have to advocate. I am her biggest advocate right now because she can't speak for herself. And learning as a new grad how to advocate even when the entire team does not listen to you, extremely hard for me. And that was the moment in the book where I talk about advocacy the most, and how I learned that in that moment, nothing else mattered but that patient in front of me. I didn't care about ego. I didn't care about the hierarchy of the team. All I cared about was what I saw in this patient and what I knew needed to happen, and I was going to make that happen no matter what.